Hi, Calaveras County. This is Morgan Gache. I'm the CEO of the Calaveras County Chamber of Commerce. Thank you so much for tuning in with us. Hopefully one of the last, I'm sure we'll have maybe another one, but one of the last reopening guidelines. It's the Unpacking the Resilience Roadmap. And we're utilizing the state guidelines. And as you can see by the lovely faces next to and below me, it's in partnership with a lot of different entities. And I'm going to have them introduce themselves here. So I want to look over, I guess it would be to my right. Deb, do you want to introduce yourself?
Thanks, Morgan. I am Debbie Ponte. I'm the Executive Director of Destination Angels Camp, and delighted that we are in partnership with the Calaveras County Health Department and Calaveras County Economic Development and the Chamber of Commerce in producing these webinars and helping our businesses to reopen and understand all the information that's out there. And even we have challenges understanding ourselves, but we're here to help you, and glad you're on board listening to what we have to say.
Thanks, Deb. Kathy, you want to introduce yourself? You're muted. Oh, there you go.
Hi, I'm Kathy Galino. I'm the Calaveras County Economic and Community Development Director. Very happy to be here today and help our businesses reopen safely.
Awesome. And last but not least, we have Kristen right below me. Kristen, you want to introduce yourself?
Hi, I'm Kristen Stranger with Calaveras County Health and Human Services Agency, and I serve as the director of the agency there.
Awesome. Hey, we sprung this meeting on you last minute, and it was not intentional in that sense, but we felt like it was better to get the information out sooner rather than later. As you have seen, and as I'm going to have Kristen speak to in just a moment, that we are eligible to have these personal services open as soon as this Friday. And so we wanted to make sure that you had as much time to prepare, gather materials, kind of reconfigure the workspace and set yourself up as much as you possibly can. And so I know there's a couple people attending now. There's probably much more that are busy at work trying to figure out how to set this up. And so there's going to be a lot more that are watching the replay of this. And so our hope is that if you're watching this as a replay and not live, please put your questions down below wherever you're watching this. We are monitoring this and we want to provide feedback for you. So please respond. Kristen, I would love for you to tell us how we even got to this point and how we are actually able to finally have some services that people have been waiting for a long time.
Yeah, myself included. Particularly to our local massage therapists. I can't wait to see you. Okay, so thank you, Morgan. Yes, so we have been on quite the journey, not only as a county, but as a state as well. So the way that the COVID pandemic response has been moving is through a 4-phase recovery approach, right? So the first phase is where we spent a bulk of our time, where we had a number of businesses that were not able to operate, really with the intention of creating extra social distancing and as a means of flattening the curve, which I know is a term we're all really familiar with by this point. We did have some essential services businesses that were operational. Those were defined in large part by the state. And so that was how we spent the first part of the pandemic. What local community, because California is a very large state, and so each county looks very different, and what the locals, predominantly in the more rural parts of our community, we're having discussions with state partners about our responses are also needing to look different to be more reflective of what the state as a whole, more reflective of than the state as a whole. So we were able to work with the state, and what they did is allow for counties that had lower disease prevalence, had the ability to do proper contact tracing, had capability within their healthcare setting, the ability to do what is called an attestation, where we submitted and said, these are factors that we have met. And with those, the state posted those attestations on their website, and then we were allowed to move into stage 2. So throughout the pandemic response, we've seen a combination of the state moving into stage 2 for various sectors, but then also locals being given the ability to move further into whatever the given stage is. So we started there first with movement into stage 2, and that was probably about a month and a half ago now, where we had the state, like I said, move into retail sectors, and then counties were given abilities to move further into it, of which we in Calaveras did utilize every one of those opportunities. That's when you saw the dine-in restaurants with the modifications start to come back in line, et cetera. And then we received word that the state as a whole was moving into stage 3, and this was very recent, just as quick as I think a week and a half ago. And that was when we started to see a number, the same follow-up, the same concept was provided, right? Where we had the state move with a few sectors of industry that were allowed to move into stage 3. And then again, attestation counties had the ability to move further. Again, Calaveras County is utilizing that flexibility and when we're provided it, and moving as far as we possibly can into stage 3, which is where we're at now. So we saw the way that worked out was the Friday before last, we received word that we could, these numbers of businesses, that's where you saw the zoos, and I think it was, there was a number of them. We did a large press release on it. And then they had the ability to go this past Friday to begin operation with modifications. And then we received word that, and we received word on Friday, which was this past Friday, that this coming Friday, expanded personal care services could also be provided the ability to operate on with modifications. And so that's when we did the messaging. I believe it was yesterday or the day before, we released a press release to our community saying, okay, we're going to take advantage of that flexibility provided by the state, and here's the guidance, and we are going to go ahead and allow locally for that to happen. That brings us to today, which is this webinar in preparation for this coming Friday. I did want to say, just because I know everything feels sudden, it feels sudden for us too. We oftentimes don't have a lot of notification that anything is coming. And so we are doing our very best to be nimble. But by this point, being into the stage 3, we've kind of gotten our feet under us in terms of doing these webinars, and I think what a lot of the community partners that I've talked to have been doing, and this is very, very wise, is understanding that the sector guidance is following the same types of formats, right, that it has from the very beginning, which is helpful. I think out the gate with the first one, we were kind of all like, how is it going to look, et cetera. But now we kind of know it's following these same types of parameters in terms of physical distancing and increased sanitation, et cetera. But within each industry specific guidance, you're going to find more nuanced details that is specific to that industry. And that's what we're hoping to cover today with you.
Yeah. No, I'm glad that you touched on that. And in fact, I'm going to have Kathy speak to a couple of points here in just a moment. Before we do that, for those of you that are attending live, at any point, if you have a question that you would like to talk about with us as the panelists, please feel free to either raise your hand and we'll bring you into the conversation, or you can put your questions, you can type them in the Q&A and we will get to them. So we'll have time to answer any questions that you may have for us today. So Kathy, the guidance and the conversation I had with Kathy yesterday, she kind of did this rolling her eyes. She's like, man, there's a lot in here. And what's interesting is that I think as we continue to progress forward, and Christian, you may have an agreement on this, but you know, these are services that have been held out for longer because they're closer contact, they're higher potential transmission places. And so the guidance gets really specific. And it gets specific for different personal services. So it's not a generalized personal services. So Kathy, can you talk a little bit about that and some of the things that you wanted to highlight specifically for people that are watching this?
Sure, I'd love to. So what is extended personal services? So it includes nail salons, facials, cosmetology, waxing, esthetician services, skincare. It also includes body art, so that's tattooing, piercing, and massage therapy that Kristen's so excited about. I am too. So those are the industry sectors, and we can tell that those are kind of different. Some seem similar, some are different. So as I went through the guidance, one of the things that I noted was towards the end of the guidance, it gets very specific by those industries. But as Kristen mentioned early on, the guidance that the state has put out, which is on their cacovid19.gov or .ca.gov, pardon me. The guidance is all on there, so you can always refer to it. We can also post it in our links during this conversation. So one of the things that's important is to make sure that you keep yourself safe, that you keep your family safe, that you keep your clients safe, and to prevent the transmission of COVID-19. So there are mitigation measures, and if you go through the guidance document, it really speaks to developing a written work site specific plan that identifies where your areas of potential contact are, keeping you and your employees safe and your customers safe, following employee training guidelines that is on the link as well. Oh, thank you. It has the OSHA guidance and the CDC guidance for employees, and really reminding your employees if they're not feeling well to please don't come to work. If you're not feeling well, you may need to close your shop for the day. And then also checking in with your customers and clients to make sure they're feeling well and that there's nobody ill in their family before they come into your shop. So they are having temperature screenings done now, and anything over 100 degrees means that you shouldn't come to work, that you shouldn't have your clients come in, and they are screening at a lot of these personal services. So I'm going to put on my glasses here so I can see better. So wearing gloves, well, actually face coverings. Let's talk face coverings first. So there is PPE requirements for wearing face coverings during procedures. And in some cases where you're doing close contact, such as facials, besides your customer having the face covering, you should really have a face shield, something that also provides eye protection, since you're going to be very close to someone's face. You should think about spacing in your place of business, making sure that if you have stations set up, that there's distancing as much as possible. 6 feet is what the minimum is, but obviously we know that that's going to be a little bit different in these personal care type industries. And then cleaning. Cleaning is going to be a big part of your daily operations. You got to make sure that you have the time to do the cleaning, to protect in between patients or in between customers, and increasing ventilation. A lot of the nail shops that I know usually have their door open or they have their ventilation system going. So really trying to minimize the and mitigate the potential concerns. So one of the other things that we're helping with businesses that are reopening is signage. So it's really important to note that it makes a customer feel good if there's signage up that says, hey, this is what we're doing, this is how we're doing it, using disposable materials whenever possible, getting rid of like magazines and things that are touchable in your waiting rooms. And ideally, you're not really going to be using your waiting rooms. You're going to have messaging with your customers to come to your facility and then maybe get a text message or a phone call saying, all right, let's go ahead and have you come in. You really don't want a bunch of people in your business at the same time. So if you have an appointment, they're also discouraging walk-ins, and I know a lot of businesses do walk-ins, but they're really discouraging that and having you have pretty specific appointments, and again, spacing if you have stations, making sure that you've got that distance in between. So there were some other interesting thoughts in here that I wanted to share. So we talked about gloves. Gloves are also not an excuse to not wash your hands frequently. So we've all been told, wash your hands, wash your hands, wash your hands. That still holds true. And especially the 20 seconds and having your customers, when they come in, you do their temperature screening, you might want to ask your customers to wash their hands before they sit down for their procedure. So on the nail salon side, which I know I've gotten a few calls on this and a few emails, so there's a few differences. A lot of the salons do have pedicure bowls that they line with plastic coverings. In addition to having that, in between your customers, you're still supposed to disinfect that bowl. So that's kind of one of the things that's different. For pedicure or for manicures, the same thing for your nail bowls. They need to be completely disinfected between use. And things like tables and chairs, remote controls, things that can be touched will need to be sanitized again between each customer coming in. Use disposable materials. As I said, a lot of folks have their prices up on a wall on a board. Try to get away from and don't use the laminated price sheet that sometimes people use. Have your prices posted so that you don't have to touch pricing menus and such. Adopt a daily wipe in, wipe out process, and make sure you give yourself enough time to thoroughly wipe common areas like desks, countertops, door handles, switches, remotes, all the various things that people may be touching in between. And there are hygiene and sanitizing protocols that are in the guidance that are specific to, they're under the EPA guidance on there as well. And then there's also CDPH, which is the California Department of Public Health guidance for sanitizers and cleaners. And then I'm not sure if we're still, Morgan, do you know if we are still have supplies available through the chamber, or we have local
yes,
suppliers?
we do. I will use this moment for the plug-in. We do. Thanks to Health and Human Services, the chamber currently has a number of gloves, nitrile gloves, only size large, sorry. We don't have different sizes, but we also have face coverings. And so both of those are available at no charge to you. The caveat is that it's just in the interim until you're able to get your own PPE order, but we do have those available for you to get started. And additionally, I'll show you really quick if I can utilize this time as well. We have a back to business toolkit, which actually, if you go to calaveras.org and click on the back to business, we have this toolkit here. And the reason I want to point that out to you specifically is because we have a list in the back to business toolkit of current PPE providers. And I know a number of people, it's getting easier than it definitely was a month ago, but a lot of people were concerned about finding PPE that was available. They'd make purchases on Amazon or something, and the delivery wouldn't come for another month or more. And so we do have 3 PPE providers in the Back to Business Toolkit. And all of these have assured us that they do have materials and products that are ready, and some even have free same-day delivery. So definitely check out these resources. If you use industry-specific supply chains for, getting your materials, you may have a longer wait getting it that way. And so if you're looking for something to start sooner rather than later, I would recommend one of these 3 here, or a combination of the 3. Hunt & Sons has, for example, disinfectant, spray disinfectant, and hand sanitizer. Those are the 2 PPE things that they have, whereas Ferguson & Scott's distributing has a little bit more of a larger selection. But Hunt & Sons is very close, so if you're in, depending on where you are, and technically Scott's is too, but Hunt & Sons, you can just drop in and pick up some of your disinfectant or hand sanitizer. So I just wanted to kind of do that little plug there.
Awesome. So a couple other thoughts in unpacking the guidance document. Think about things that you could do without, such as like samples or testers. That's obviously a huge transmission concern. You got people trying to test stuff or wanting to touch stuff. So you might want to kind of eliminate those for now. And cleaning non-porous things such as your tweezers or scissors with hot soapy water, and then also following your industry guidance, your state guidance for your licensing. those are pretty strict. I know that when I've gone into salons and such, things have to be disinfected. So really follow your own state's guidance or your state licensing guidance. One of the other things I found interesting in the guidance was changing smocks between customers. So some folks wear one smock per day. So you might want to really consider, they're strongly recommending that you basically change your smock, especially at a nail salon, between your customers. And then, as I said, follow your board of cosmetology, barbering, and so forth. So on the customer side, we talked about confirming appointments with your customers, making sure that they're feeling well, letting them know what time their appointment is, to please have them wait outside or in the car until you can text them or wave them in, make sure they're feeling well. And if they're not, or if somebody in their family might be ill, you should really reconsider rescheduling that appointment for 14 days. Discouraging walk-ins, I know that's hard because some of our businesses, if they have downtime, then a walk-in is appreciated. But it'd be really hard if you're already booked and busy and then you have a walk-in. So you really want to try and discourage that at this time. Okay. So discarding handshakes and hugs. We've missed our people. We've missed our people that have provided these great services to us. And I want to think that they missed us too. But so no hugs. You can do air hugs or hugs from a distance. And then also try and stagger your appointments. One of the things that we are finding is that, or that I've heard, is that they don't have enough time to clean in between customers. So make sure you give yourself that extra time to clean, wipe everything down, remove your plastic, your coverings, your protection, and sanitize, sanitize, sanitize. Last really big point, and then as I said, the guidance is very specific, whether you're a tattoo parlor facility, if you're a massage therapist, if you're a nail salon, and I could spend all day talking about the nuances of each of those. So, please reach out to me. I'll put up my email here in a second. You can reach out to me directly or call me directly, and we can talk about those specific nuances. But the last piece that I want to leave you with is, God, Venmo is a beautiful thing. Doing payment plans or payment of services electronically is really the wave of the future, and it keeps you away from having to touch money and those types of things. So really look to using electronic payment forms for your customers.
Yeah, thank you for sharing that.
Yeah.
There is a lot of detail in there, but again, if you have any questions on the specifics, if you've not yet seen the guidance that we just went through, the link is down in the webinar chat. We'll also put it in the comments if you are watching this video as a replay. Deb, there's a lot that you have conversations with people in your community. And I'd love to hear you kind of share some of the things and the reminders that you have for these businesses as they reopen, some of the things they need to be considering and to look out for.
I just can't get used to that muting. Yes, I find that, with the COVID regulations, that's just another layer of work that everyone needs to do to remain safe in their business environment and to their customers. But also there's the business aspect. As most businesses have been closed for a period of time, now that you reopen, it's good to check out some of the administrative tasks of your business. And the number one thing is really, making contact with your landlord that you're up and going again, if there's any concerns or issues that need to be addressed with your landlord. Second is your insurance. That's most critical. If you have been closed and perhaps you put your insurance in a hold mode, or you got a discount of sorts because you had your business there, but you weren't seeing clients and customers. Some insurances were offering discounts and such. So you want to check with your insurance carrier to make sure that you are up and going again, and that you're covered on all areas of your liability insurance and your workers' comp and those kinds of things. Don't assume. I'm finding a lot of people are assuming it's okay. You should know, it's on the news. Everybody knows. It's on social media. So don't assume. Just find out for yourself in your particular business that you're okay, both with your landlord and on the insurance component. And those are real critical, because I'm finding some insurances are kind of putting some businesses through the test. And it's also an opportunity for insurances to make sure that businesses are properly insured. Maybe you bought something 5 years ago and you did this, and now you've added this product line, or you're doing that. So it's just good to touch base with your insurance to make sure that you are well covered. That's what I hear most about. The other thing I'm hearing about, and I don't know who can address this on the panel, but it's something to pay attention to, that if someone does come down with the COVID and it is traced back to maybe your particular business or your industry, maybe not your business, but within the industry, what kind of effect does that have on your insurance? That's something too that I think there's a lot of unknowns about that, but it's in the back of people's mind about what that might mean to your particular business or to your industry. And then with that question, and this is more in Kristen's realm, is, because personal service is so close and personal, and if there is a COVID outbreak and it's related to the personal service industry, what does that do? Most think it's going to shut us down again. We have to go back to where it was, or whatever it might be. So I don't know if Kristen can maybe highlight to that. Maybe there's no known answers to it, but it is something that's in the back of people's mind as we're opening up more. And now we're getting a little bit more closer in regards to the personal service and potential for personal contact, or stepping past that social distancing guideline.
Sure, I could take that in two parts, actually. Thank you, Debbie. So the first part is, as you very likely know right now, when it comes to reopening in the various phases, there are a number of, as part of our attestation, the county health department had to put forward a number of proposed triggers that basically said, if we start to see an alarming increase of disease prevalence, as well as increased use of ICU beds, as well as a lack of ability to do proper contact tracing, which is a component associated with pandemic response. There's a number of these different factors that we are constantly evaluating on our own, but then also being evaluated by the state too. And basically, it's not a one-for-one. It's not if we get this many of cases, that means that we automatically go back into the into further restriction of businesses being open and such. It's actually a plethora of different factors that we're taking into consideration to make an informed decision. So again, we're always looking at those as a whole. We have had an increase in cases over the past few days, but we haven't had other triggers that are more causing us concern at the current time, which is why I always try to utilize an opportunity to kind of, because I think people automatically think that the first one, right? And this means this, and it's really a much more detailed conversation than just that. As it stands right now, none of our triggers are at a rate where they are alarming, hence why we're moving forward as we currently are. If we did reach that point, we would need to properly message it with our community and such. But what it really lends itself to is, we don't even, if possible, we don't want to be in those realms, right? We don't want to be having any of these triggers we don't want to be contributing as a community to increasing to those triggers as we can, because that's what's going to allow us to continue to progress to reopen. So what we can do as community members, as businesses, as government, anything, is to really go back to kind of the basics that we've always been saying, all those protective measures, the sanitation, the social distancing, et cetera, really take seriously these guidance documents that are being put into play, or that are being put out for utilization. They're meant to protect not only those who are providing the service, but those who are receiving the service. And so taking those into consideration, as well as being mindful of all of the measures that we've been discussing for the past several months now, that is what's going to create the most protection as a community as we possibly can. And when we as a community become laxed on those, we're going to see us inching up towards the triggers, and that's what we're really trying to all avoid. the purpose of the personal protective equipment is really that we know there are going to be industries and sectors that are going to require closer contact. And with the main way that COVID is spread is through droplets and being within a close proximity. That's the primary way that it's being spread. There are secondary ways, but that's the primary. And this concept of being close together obviously kind of goes against that. That's the whole purpose for having the personal protective equipment and in the increased sanitation and such, is to mitigate that risk of potential disease transmission as much as possible. So the best thing you can do is to make sure you're taking those guidance documents to heart and putting those measures into place. You're wearing your PPE, you're requiring your customers to adhere to them, and that's the very best protection you can be providing for your community.
I have to insert something here because I actually went to the dentist this morning, and I know it's a totally different sector, but it reminded me the importance of how the consumer feels. And the dental office I go to is like above and beyond anything I was expecting for my safety and for their own. And I didn't realize how much of an effect that would have on me, especially in an area where usually there's high anxiety going to the dentist. But the measures and the precautions that they took to show what they were doing to me as a consumer was really helpful, and it made me feel more comfortable. And so I think that's important to remember as we reopen. What are we doing to show this? Because sometimes there's hesitation. Oh, I feel bad, I don't want them to wear a mask. And, you know, oh, I feel bad, I don't want them to do this. But remember, it's protecting you. And also, a lot of people are actually really grateful for the precautions that you take and taking their safety seriously. So don't minimize that. Deb, you had a second question to that, and it was more of the insurance. Kathy, can you speak to that piece? Because I can't. No, you're on mute. Okay. Okay, well, if you have any guidance on insurance that you could potentially put in the chat that we can also share in any replays of this, that would be fantastic. So thank you for that. Deb, Kristen, do you either of you have anything else you want to add? And before we go into that, if you are attending this live and you have any questions, please feel free, raise your hand, ask questions in the Q&A, and we'll bring you into the conversation. If you have questions for Kristen, for Deb, for Kathy, that you may want to have answered, and we will get to those. Otherwise, if you are watching the replay of this, then please put the questions below, and we will be monitoring that chat for sure. So to Kristen, Deb, do you guys have any closing pieces, any closing thoughts for everyone?
Yeah, I do. We all know that there's a tremendous amount of information everywhere right now. So I did put in the chat box a link to our Calaveras County COVID page. And if you ever feel like you don't know where to go, that's a great starting point. We have we've uploaded all of the guidance that's allowed for all of the industry sectors that are allowed to be reopened in Calaveras County with modifications. And we tried to simplify that, not go into detail about this is a state one or this is a Calaveras County attestation one. That's confusing for us. So we just keep that very updated in terms of communicating to our public what's allowed to be operational with modifications in Calaveras County. So I encourage you to go to there. That's a great landing point. I also wanted to clarify, because there are some jurisdictions that are doing dual guidances. So you've got the CDPH guidance as well as like additional requirements from that local jurisdiction. We've made the decision that we are not doing that. We are just deferring to all of the state guidance as single documents to follow. Because those are comprehensive, but also it's a lot to have multiple types of things people are trying to be following. So again, the only documents you're going to need to be mindful of in terms of preparation and meeting the guidelines are those that are for your particular sector. And then we also have elected in this county not to move forward with reviewing individual site business plans prior to reopening. A few jurisdictions do that. They require the county health departments to review prior to reopening to basically assert that those individual businesses have met the requirements. We're not doing that. We know our businesses in our community are great partners and all have the best interest of our community at their forefront of their mind and heart. And so what we are just doing is communicating what the guidance is, and then you go ahead and go forth on your date that you're allowed to reopen. If you have questions, of course, you can reach out to the call center line, you can reach out to us at Public Health, etc. But those guidances are meant to be overarching and provide that detail. And actually, I've reviewed a number of guidances. In reviewing the one for extended personal care services, actually one of the more clear ones, in my opinion. I think it's pretty like, step here, do this, and that's nice. And so I think those are kind of the main things that I can think of.
Great.
Yeah, I would agree with that too, you know, and when we mentioned the thing about the insurance, I have found it best that people contact their carrier, because I'm finding everyone's a little different. So there's no over general guideline in that regards. And, you know, in addition, this industry has a governing board with the Board of Cosmetology. So that's another resource to check out with. And I know the board here lately has been very, you know, much more available in communicating and providing some guidelines and things along that line. And I do know that they are, you know, out and about inspecting, but it's more on the educational approach, not a punitive approach. So it's a good opportunity to, you know, ask your questions. And if you need to make the phone call or the email, I know they're accessible that way too. I think, you know, what Kristen said too, you know, I'm hearing from most businesses that it is a very cooperative working relationship with many different entities. There's no one entity out there, especially in our community, in our county, that is on a punitive role. We want to see our businesses reopen. We want to see the success return, and we want to make sure our resources are there to be helpful and to provide all sources of information and referrals and that sort of thing. So it's certainly not a punitive kind of thing from any of our agencies. And it is nice to see that our county is piggybacking on the state regulations, because it is very confusing out there. And as I've talked to other communities and other counties, I'm very thankful that we are doing what we are doing, because some of these businesses in other outlying areas, they're finding it very confusing and cumbersome. And it's like, why even open? I can't deal with all this mixed messaging of what to do and how to do it.
Yeah, I have to second that.
Good luck. We're all anxiously awaiting. I can't tell you the number of people out there that are just waiting to get that pedicure now that summer's here, and the manicures. And I don't know about the tattooing just yet, but I'm considering it.
Oh, good. You got to get a COVID-19 tattoo.
Oh, I don't know.
Hey, we have Jacqueline has a question. So she said, if a client informs a service provider that she learned after the fact, after the appointment, that they had been exposed to someone infected, are we to contact our local health department, temporarily close, etc.?
So I can take that one. So the way that contact tracing works is a little bit reverse of what you just said. I mean, it could happen this way by all means, especially in a small community where people share information. But when we receive confirmation at the health department that somebody is positive for COVID-19, we begin a really robust contact investigation that's then followed up with contact tracing. And what that means is that we get a plethora of information from the individual who's been COVID positive. We ask them various questions about, you know, who have you come in contact with, and what were the mitigation measures that were in place prior when that contact was occurring. Was it 6 feet without a face covering or what have you? And all of that takes into consideration what the contact tracing is going to look like. And then we begin to follow up with those individuals who did come in contact with that individual. And it met the specific criteria of which it's going to be different. So I can't give an overarching thing, right? It's going to depend on what that contact looked like, what types of protective measures were in place, et cetera. And we will contact, as the health department, the various entities and then provide guidance that's specific to that particular interaction. What I would suggest, and this is kind of, we get asked this question a lot actually, and the way we respond to it more is, you can avoid being an individual that's part of the contact tracing if you're doing the preventative measures in the first place. If you're wearing the PPE, if you are washing your hands, if you're doing the operations the way that we've outlined here, there's a high possibility that you won't be considered a close contact and thus needing to move into the quarantine section, et cetera. All of this goes out the window if someone's symptomatic. Obviously, if you're sick or ill, you need to just stay home. You need to contact your healthcare provider or us. All of that applies to anybody, whether you be COVID positive, come in contact with COVID positive, or if you're just a person who's in the world and you experience these symptoms. That's an overarching guidance. So I would say this is my worst response ever. It depends on the concept of, do you close? But that's kind of going to depend a little bit on you. But if you're doing this increased sanitation constantly, and you are making sure you're wearing the PPE, et cetera, you are positioning yourself to the best extent possible to prevent from interruptions of service and also further disease spread.
Yeah. Thank you. That was, it's tough to have some of those ambiguous answers and responses. And I know that I've utilized Kristen recently too in some of that. And it's hard, but it also, I'd rather just know what precautions to take and how to move forward. And so that was great for the clarity. And thank you for that. If we don't have any other questions, I know Kathy's gonna sign her last comments that she has. So if she put her information in the chat box, if you have questions, please feel free to reach out to her. She loves phone calls at 3 in. And I just want to say one other piece too, because I don't want to ignore the elephant in the room. And that is the Walker fire, which has nothing to do with COVID-19, except that we're talking about reopening businesses. And I think it's our responsibility to also remind you at this point, please put emergency plans into place for yourself and for your businesses. And I know that's one more layered thing, but we're in that season, we're in that era, unfortunately, where we have to consider that too. So it's one more thing to add on, but to create your emergency backup plan. That would be great. Oh, Calaveras Alert, sign up now. Yes, if you have not signed up for Calaveras Alert, and can you put the link for that below, Kathy? That would be awesome. Yes, that's super helpful in case you need to. Thank you so much to those of you that joined live, and thank you for the question. And I imagine that as this continues to get watched, there's going to be a few other questions that come up. That's great. Please make sure you ask them below. We are monitoring the responses, and we want to help give you as many tools and resources as we can prior to your opening. So thank you so much for your time. Stay safe, stay healthy, and have fun opening. Take care, everyone. Bye-bye.